Do we have too much government?
We need to put people ahead of corporate profits.
This system is so lopsided.
This threat is a real threat to democracy.
And I think that's really important. That's something we haven't been doing in this country for a long time.
Where do you start? What do you do? How do you do it?
Access to Democracy and other Eagan community television programming is supported by Thomson Reuters, makers of Westlaw Next and based in Eagan. Through Westlaw Next and other innovative online services, Thomson Reuters is the world's leading source of intelligent information for businesses and professionals. Online at thomsonreuters.com. And by U.S. Federal Credit Union, the member-owned financial institution offering service, value, and experience you can trust to the greater Twin Cities community.
Access to Democracy returns, and we return with a return guest, and I'm happy to have him back, Dave Feinwachs. And Dave, thank you for joining us again.
Pleasure.
An interesting story about Dave Feinwachs. He's an attorney. He is one of the leading healthcare specialists, probably in the country, rather than just locally. He was the counsel for the Hospital Association, Minnesota Hospital Association, and in that job, Dave discovered, big surprise, tremendous waste of money. We're not talking about nickels and dimes. We're talking about millions of dollars. And he wanted to make the disclosures. Ultimately, he did. People didn't want those disclosures made. They wanted him to keep quiet about waste and fancy bookkeeping, things like that. He was offered money. He told them a couple of things, as he said to me, and it wasn't Merry Christmas. So he made the disclosures, and what happened? He was fired. Like the stories of so many whistleblowers, of people who are trying to do the right thing, they do the right thing, and the system, the corporations come back and they bite them. And you know, you had a lot of courage for doing what you've done.
Well, thank you. Although in my case it was a little bit different because the good stuff didn't start until after my employer and I parted company. Because of the nature of my work, I was a lobbyist. I just kept on going. I returned to the Capitol and kept pursuing the issue, minus a constituency, but still armed with the facts and a hunger for the truth and information. And we're now in our third year of pursuing the facts, and some remarkable things have happened since this all started.
Federal investigations, state investigations, the possibility, hopefully, of some criminal indictments down the road.
Hopefully. You know, we've had some audits, and a number of remarkable things have occurred that no one ever thought was possible. And in that respect, I think we've all been very, very fortunate because we may actually get to the bottom of this.
And when you say get to the bottom of it, what are we talking about in terms of dollars to Minnesota?
Well, likely we're talking over an 8-year period of probably $500 million of...
With a B.
With a B. $500 million, which I would peg as a minimum. And there's some controversy about this. But in the end, what we're talking about is the integrity and the future of the healthcare system and whether or not people have access to healthcare, and also the Affordable Care Act and whether these programs can work, which I, as well as many people, believe that they can, but they can't work in the current system. They can't work with the kind of dead weight that they're encumbered with now. And so by rooting this out and by suggesting changes, we could actually create a system where everyone has access to high-quality health care in a system where they can afford it, and really the kind of decent system that we as a society deserve.
Well, let's tell the listeners, the viewers, how many countries in the world in the industrialized modern world have health care that they supply for their citizens, and how many don't?
Well, the answer to that, based on my best understanding, is fairly simple. All of them except us. We are the only country that treats health care as a commodity, which is odd, because I think most people would view it as a human right. Most people believe that we don't let each other freeze to death in the cold. We don't let each other starve to death from lack of food. And arguably, we wouldn't let each other pass away from lack of access to health care. But in this country, we have the best health care system money can buy. And the problem is, if you don't have any money, you're out of luck.
Now, health care costs in this country as compared to any other country, the next leading country.
Healthcare costs in this country are very high. I don't have the exact statistic, but they're probably twice as much as
the next leading country.
The next leading country.
They are. I have the statistics.
Yeah, they're very, very high. And ironically, our healthcare outcomes, the metrics that we use for determining a quality functioning healthcare system, are equally out of whack. We have bad infant mortality numbers. Our life expectancy isn't as good as other countries. Virtually all of the measurements and indicators would seem to say you're doing it wrong. And certainly we can do it better. Our healthcare providers are the best in the world. Our technology is the best in the world. It's our system that's the worst in the world.
Well, all these other countries that send their young doctors and healthcare professionals here to be educated must do it for a reason. Isn't that fair to say?
Absolutely. I think our education...
And then they go home where they can provide health care cheaper and in some cases as good. I mean, the good hospitals in India, for instance, are outstanding. Most of the people in India, unfortunately, can't afford those good hospitals and can't get to them. But it's not a lot different here.
It's not a lot different here. If you're uninsured, and for many people, even if you have access to insurance products, for example, the heralded health savings account, if you're a person of modest means and you have coverage, but you're responsible for the first $5,000 or $6,000 of your own costs, the predictable outcome of that is people won't seek health care. They can't afford it.
It's interesting because the legislature, and I say the Republican legislature in North Carolina or Texas or one of those other great forward-thinking states, just cut unemployment benefits to 20 weeks. Now, to say to somebody who's unemployed, who has a family, oh, you can get health care, but you've got to put up $6,000 up front for a health savings account, is like saying, you know, can you leave for the moon this afternoon?
And, you know, additionally, you have to examine the real fallacy in the health savings account approach. Because the notion is, if we make people responsible for significant portions of the cost of their health care, they will become empowered consumers. Has anyone actually tried to negotiate a price for health care services? If you're in a car wreck, can you imagine being brought into the emergency room on a gurney and say, wait, I'd like to discuss what this costs before I bleed out?
Well, in this county, actually, you could be brought into an emergency room where somebody would say, we're going to charge you, or how much are you willing to pay, until the Attorney General put a stop to it.
Absolutely. So the notion of, I mean, but even in less dramatic results, try asking someone what it costs. You'll be given a ridiculous range, and for ordinary people, you know, to tell someone, it'd be like going into a car dealership. I'm interested in this particular vehicle. What's it going to cost? Well, it could cost anywhere from $9,000 to $20,000. How do you arrange for a transaction like that? How do you get useful information? You really can't. What we need is the certainty that other civilized countries have. That's what we need, and we need to stop treating what is essentially a basic human right as a commodity.
Now, it couldn't possibly be that because there's a profit motive involved in our health care, that's why it's so screwed up. Could it?
Well, I think it would probably not be too cynical to say that that is a contributing factor. And there's nothing wrong with making a profit. It is the American way to make a profit, but the notion is if you're going to make a profit, you should provide a service of value. You should provide a value add. You should give people something that helps them or that they find desirable. You should be excellent in the marketplace. There's nothing wrong with profit motives attached to that. But to create a confusing, convoluted system that victimizes people and to set up mechanisms that are simply designed to drain resources, that's not really what I would say a justifiable way to make a profit. And of course, in Minnesota, we have the ultimate paradox. Our law requires that all of our healthcare organizations, our insurers, our HMOs, have to be not-for-profit. And they are not-for-profit, at least in terms of legal structure, but in terms of profitability, their profitability is astounding.
Now, by astounding, you mean, for instance, what are their reserves? Let's talk about reserves. And obviously, insurers, any kind of insurers, have to have some reserves.
Insurers have to have reserves, or what people would think of as money in the bank, to pay claims. But here's the fascinating thing. What we're talking about is public health care programs. We're talking about medical assistance, Medicaid. We're talking about Minnesota Care. We're talking about things which the government funds. If you're an insurance company, you need to have reserves to pay claims because you've sold insurance policies and you've put yourself at risk for what might happen to the people that you have covered.
So we have a pot for reserves, and we put it over here for claims that are existing.
But with our public programs, no one's at risk. Because what we now know is whatever these companies experience, their so-called experience rating, the state pays them back in full in the subsequent year. So there really is no risk to these programs. If there's no risk, why are we reserving? Why are we reserving in massive amounts, which drives up the stated cost of the program? And the answer for programs like Medicaid is because it's half matched by the federal government.
And when you say massive amounts,
billions
an example.
Billions of dollars. Our health plans currently have reserves, last time I looked, in excess of $4 billion. Now you have to understand, when I say reserves, I'm talking cash and cash equivalents. If an insurer buys stocks in the stock market, it doesn't count. If they buy a building in real estate, it doesn't count. Reserves are pure cash. So their assets, what they hold, is very likely far, far greater than cash on hand in pure cash terms, but they have enormous amounts of pure cash, and the majority of it comes from their participation in these public programs where they are not at risk. The state holds the risk. Most of our healthcare system consists of government programs and ERISA employers, large self-insured employers. And what these entities have in common is that they hold the risk, and the role of the insurance company is merely as an administrator, as a disbursement agent, as a paymaster. And the odd thing is the paymaster gets rich. The employer or the government experiences huge cost increases. People find it difficult to access the system, and the paymaster does extraordinarily well.
Well, let's get into that, because in this state, we have a cap of 1%. They can't make more than 1% profit.
Okay. That isn't exactly correct.
Oh, it's not.
What happened is, in 2011, I believe, Governor Dayton negotiated with the plans a so-called voluntary 1% cap, where they agreed that anything that was over 1% in terms of their profitability, they would give back to the state on these public programs. What's interesting is that their contracts for these public programs only allows them to make 1%. So essentially what they agreed to do is for a single year abide by the contract. Now, this has been heralded as some great achievement. All we did was make them agree to the terms of the contract for a single year. And, of course, when you have a cap on profitability, you can manipulate that because you can increase your stated administrative expense and other things to play with the numbers. And so as a result of that, it is, in my estimation, a fairly meaningless term. But that aside, according to the numbers which were published, by requiring them to adhere to the contract for a single year, we recovered $103 million. In 2012, I had the privilege of testifying before Congress, and during that hearing, I said in response to a question that what has occurred in Minnesota is because we said the word audit, we recovered $103 million. Imagine what would happen if we did an audit.
And I think that's finally coming to pass.
Last year, because of the public reaction, because of programs like this, because of coverage by the mainstream media, because people are finally starting to understand and become enraged over what's happened, the state of Minnesota contracted with a forensic actuarial and accounting firm, probably the preeminent one in the country, the Siegel firm, to take a look at Minnesota's managed care rates and methodology for the period from 2003 to 2011. And when they did this, I think that what the Department of Human Services, what the state hoped is that this firm would come in and sort of do a quick and dirty analysis and say, it's all good. And what happened, of course, is we got a report at the end of March this year, which is as far from all good as you can possibly get.
Does that happen to be the Siegel report right there?
This happens to be the Siegel report. It's available online. It is called Minnesota Department of Human Services Actuarial Review of Medicaid Managed Care Rate Setting. It is dated March 28, 2013.
Why don't you hold it up so the camera can get a close-up of it?
It is, I would commend to you reading it. Don't be put off by it. It is in total length over 100 pages, but you need concern yourself only with the first 25 or so.
And what did they show?
The Siegel report showed a number of fascinating things. Number one, it showed that every year for the 8 years in question, our HMOs took double the amount of money they were supposed to receive under the contract, twice as much. It showed that during those 8 years, no one called this into question. In fact, Siegel said, it's unbelievable, it's amazing that no one noticed this. Now, there is a concept called actuarial...
See, I'm a cynic. I don't believe that no one noticed this. I believe that people turned away because they were living the good life.
Well, I wouldn't disagree with you. I believe that the people who should have noticed it were not interested in noticing it. I believe that it needed to be noticed because it was a program out of control, working to the disadvantages of citizens in this state, but in fact went unnoticed, and Siegel said somebody should have noticed. In fact, if I may, to quote, a reasonable individual provided with the information Siegel received would conclude the state, the plans, and the actuaries must have understood that historic and forecasted losses on non-Medicaid programs would be covered by historic and forecasted profits on the Medicaid program. What this says is it's clear that we've been cross-subsidizing programs for the benefit of these insurance companies. This is what one of the findings...
And these companies, even though we are a not-for-profit insurance situation, and I want to touch on that in a moment, have executives who make massive salaries. Is this not correct?
These companies have executives that are well paid. It's America. These are big companies. They have people who make more than $1 million a year, in some cases more than several $1 million a year. They have highly paid senior management teams. They have enormous reserve balances. They have enormous holdings Yet these are nonprofit corporations that exist to provide health care for the people that they arguably serve. Now, even a cynic like me will admit to the old maxim, no margin, no mission. Even not-for-profits have to make some kind of profit or return to stay in business, to be healthy. But the numbers we're talking about...
Nobody quarrels with that. But what really is troublesome to me is that, just as you started to say, the numbers we're talking about are obscene in terms of how much. And we're also talking about executives down the line, not just the CEO, that are getting $1 million or more than $1 million apiece. Really, really huge salaries. And I don't know what all these people do. I don't know if they know what they do.
If you look at our HMOs, it is not uncommon to find that a vice president of marketing makes more than the medical director or the chief medical officer. So I want you to contemplate
How
this.
about the governor of the state?
Oh, the governor of the
He's
state.
way down the line.
The people running terrazzo polishers make more money than that. We're talking about people who make huge amounts of money. And when you look at what they do and what benefit it provides to these nonprofits, and remember, nonprofit HMOs, nonprofit hospitals, I would suggest to everybody viewing this program that a little righteous indignation is in order here, because let me remind you of something. We all pay more taxes so they don't have to. Therefore, we have an interest in their operations. We are, in fact, the shareholders. We pay more so they don't pay any. So you're entitled to know, you're entitled to ask, and you're entitled to be upset when it isn't working right, because the notion that, well, it's un-American to interfere with private business. Okay, most private business isn't set up as nonprofit corporations. Most private business isn't set up under the IRS code to have a mission to provide health care and health services to people. So that assertion rings a little hollow to me. I say it is our business, and we've been lax in conducting our business, and now it's time to get angry.
Let's talk about administrative costs. I know that the Medicare program operates on what, 2% to 4% administrative costs?
Yeah, I think the administration of the Medicare program is in fact between 3 and 4%.
What's the average administrative cost of an HMO insurance company in this state?
Okay. Depends who you talk to. Former Attorney General Mike Hatch had it pegged at something close to 45 to 50%, but let's be kind for the moment. Let's take the HMO numbers. They say it's 10%. It's 10%. Okay? The government runs the program for 3 to 4. They're running it at 10 because obviously they're better at it.
Or are they better at it?
Well, I would argue that if your numbers are 2.5 times what the government is, you're not better at it, because most people would say that government has some built-in inefficiency. You know, whether you like it or not, clearly bureaucracy has some inefficiencies incorporated. And so if the government can do it for 3 to 4, and you're doing it by your own admission at 10, and by the way, I don't believe that 10 for a moment. I think it's closer to 25.
That's the figure that I see that's out there generally, 25, 27%.
Exactly.
Administrative costs.
Because
not going to health care,
right.
Not going to patient care,
right.
Not going to anything.
Right. You know, if you put your name on the plastic beer mugs at the baseball stadium, I'm sorry, that's not medical education. You can write it off as medical education, but it's not medical education.
I happen to be in the UCare program, and you're telling me that they paid for those mugs that say UCare at Target Field?
They didn't get them for free.
I thought that was a donation.
Well, interesting. They claim they made a donation to the state of Minnesota in 2011. They claim they gave $30 million to the state as a donation. That was an interesting circumstance, too. Number one, most people are very surprised that an insurance company would give $30 million to anyone. And number two, they wrote an interesting letter with that donation explaining that a state program called General Assistance Medical Care, or GAMC, was being subsidized by an inflated Medicaid rate, which, by the way, is not lawful or proper, and that when that program was eliminated by Governor Pawlenty, the rates for Medicaid were not lowered, and I'm quoting UCare in the letter, to reflect that overpayment. Now, the return of an overpayment is not a donation.
I would say it's not a donation.
And I don't think you need to be a lawyer to reach that conclusion.
We got caught with our hand in the till, and we better give it back someplace.
So, to their credit, they gave it back. But this began a cascade of events that triggered some fairly common sense questions. If you're giving back $30 million and you're the littlest HMO, where's the money from the other ones? Why is there no money from the other ones? How could such an overpayment occur? Was this inflated Medicaid rate legal? Did the federal government know this was going on? How could we have a system that allowed these things to occur undetected? Where's the integrity in our system? And I'm not talking from a theoretical standpoint about we should be pure and honest. I'm talking about the money that's being spent here, literally, for some people, is the difference between life and death. And I'm not being melodramatic.
I want their accountants to do my taxes.
Well, you know, it's funny you should say that too, because the other fascinating thing about our system is we take these companies at their word. They tell you, they tell us, they tell the state, this is what we got, this is what we need, this is what we owe to you, and we take it as the gospel truth. Now, I would like to pay my taxes that way, but unfortunately, the State Department of Revenue, the IRS, the authorities, they're a little more demanding. They come forward pretty often and ask to see receipts. They want to do audits, but in our healthcare system, it doesn't happen.
But some of us don't take them at their word. And when those some of us speak up, as you did, you find yourself cashiered. You find yourself on the outside looking in. And we're not going to have time to pursue this, but I want you back soon to continue this conversation within certainly a month or so, because we're just scratching the surface here of massive amounts of non-patient dollars that are being wasted or that are being taken without being put to patient care. And I'd like to talk about single payer. I'd like to talk about some of the other things. And we really have run out of a half an hour, and I have so much more to ask you. But thank you, Dave Feinwachs, for being the conscience of really the industry in this case at great personal cost.
Thank you.
I really appreciate it. Thank you.